Now we're going to understand about the role of obesity and diabetes. Diabetes is a big, vast term. A lot of people wouldn't know what is diabetes also. Most of us, we know diabetes means high level of sugars. It comes with the age. You have to start with the treatment, end with insulin, and end with your life. So once a diabetic, always a diabetic. But that's a myth. No, it's not. Let's understand what is diabetes. What we eat and drink goes to our stomach. From there it is absorbed in the blood vessels. The bloodstream will have high level of sugars. The blood flows everywhere, goes through the liver and all, and there the receptors start giving stimulation. The message goes to pancreas to send insulin. The pancreas sends insulin, the sugar level goes down, and that is the sugar metabolism that happens. Now what if the message goes to pancreas and the pancreas doesn't send enough insulin, say 50% of the insulin which has come, so only 50% of the sugar will go down, so sugar level is still high. That's called as diabetes. This is one type of diabetes. There is something called as type 1. Type 1 diabetes means pancreas doesn't produce any insulin. The pancreas is like a stone, it's no more an organ. That is type 1. So this starts immediately after your first few years, that children start showing up reasons for diabetes. These small children are kept on insulin. Very difficult to manage. Type 2 diabetes is a adult onset diabetes. Most of the diabetics are type 2 diabetes. What happens is just explained. There is something in between. These days it's called as type 1.5 diabetes. Some people, they live their normal life until the age of 20, 22, 25. And one day suddenly they see they have some symptoms about diabetes. They go to the doctor and the doctor says your sugar levels are 500 or 600. What happened suddenly? Suddenly they have started showing insulin dependent diabetes. The tablets would not work on them. So they have to go on to insulin from the age of 25 onwards. Reasons not known. This is sometimes called as type 1.5 diabetes. In type 2 diabetes, what we have seen, in a lean thin person also we see type 2 diabetes. The patient or the person may not be obese, but most of the obese people, because of the peripheral fat, they have resistance. The insulin falls short. Though the pancreas makes insulin, but it is not serving 100%, and that is the reason they are diabetics. There is one more thing in diabetes. The stimulus that goes from liver to pancreas also sends 100% insulin. But before it would lower the blood sugar level, there are some antibodies that they come and destroy the insulin. These are called as insulin antibodies. That is another reason for you to be a diabetic. Now, having learned there are so many reasons behind anybody's diabetes, then we plan action for those patients. Now, all these patients are firstly investigated properly, which type of diabetes that they have, and the treatment is planned. Most of the time, obesity, which is reduced just by 10% of that excess body weight, there are a lot of good changes that they happen with their blood sugar metabolism. Now you will ask me, how do bariatric surgeries help these diabetics? Bariatric surgeries help on different hormones in the body. Now obesity means there are different hormones coming from different places. Earlier on we used to consider thyroid, pituitary gland or suprarenal glands as endocrine organs. They are so tiny. But today the excess of fat is a big endocrine gland. It secretes a lot of hormones. The intestine, that also secretes a lot of hormones. So by altering this, there is a good effect going to pancreas. Pancreas starts making new insulin by making the new cells in the pancreas. And that is a primary reason that after obesity surgery, by alteration of this intestine, our own body insulin starts secreting in a good way. So all the drugs required otherwise, they are reduced. And that is how the person treats its own diabetes with its own insulin.